So let us begin with another remedy of Allen's keynotes, which is very valuable, especially in septic conditions when we have already failed with pyrogen or arsenic, or we feel that there is a combination of the septic nature of pyrogen and the restlessness of arsenic or the foul smells of arsenic. So we have two components of two different remedies merged in this one remedy, which is anthracinum. And you will come across a patient who has an ulcer or a pathology which is localized and foul smelling since many days. You have given some medicines already and you have failed. That is the phase where you should land yourself with anthracinum. So you see, the first line is in Allen's keynotes, in carbuncle malignant ulcer and complaints with ulceration, sloughing, and intolerable burning. So you have some elements of arsenic, some elements of sulfur, some elements of pyrogen, or you can say it's the end product of all these three remedies which is combined. When arsenic or best selected remedy fails to relieve the burning pain of carbuncle or malignant ulceration, anthracinum is the remedy that we should think of. Hemorrhages, blood oozes from the mouth, nose, anus, sexual organs, black, thick, tar like, rapidly decomposing Crotalus horridus. In Crotalus horridus, we saw how the blood is decomposed, how it is dark in nature, how it is tar like. Similar presentation we'll see here, and especially I had shared that the prothrombin time in cardiovascular cases, in patients who are on medication for a long time, the prothrombin time is very much reduced. That is where you should think of the remedy Crotalus horridus and snake remedies especially. Anthracinum is one such remedy which you should think of, where as soon as the bleeding happens, the blood is decomposed, has a foul odor, and the patient is totally debilitated like a arsenic or veratrum case who is on the verge of collapse. Next you have is septic fever, rapid loss of strength, sinking pulse, delirium and fainting. Pyrogen is one of the remedies we always give in such cases, especially septicemia. But anthracinum has its own special place of action, and if we are to give this remedy, we should know that it is especially to be given in foul smelling odors where there is state of the patient already going towards more weakness than we normally see in arsenic and pyrogen. Dissecting wounds, especially if the tendency is to become gangrenous, septic fever, marked prostration, arsenic and pyrogen are the other two remedies. Septic inflammation from absorption of pus or other deleterious substances with burning pain and prostration. Arsenic, pyrogen again are the other two remedies which we think of in such conditions. Bad effects from inhaling foul odors. Those who are the workers who work in drainage systems or those who work in chemical factories, that's the special place for anthracinum to act. They'll have putrid fever, dissecting room. We all as medical students have been to cadaverous rooms in our anatomy class in first year BHMS, and the smell that is emanated from that place of formalin is so marked and so odorous, makes us feel kind of dizzy or vomit, or kind of that is the actual nature of the state of anthracinum can be thought if the effects of the smell are too long, too prolonged, and there is poisoning by those smells for a long time, especially a state of pyrogen or arsenic is created, there is weakness, and you are thinking of giving those two remedies, but it's a combination of these two remedies which we should think of when prescribing anthracinum. In the skin, we have gangrenous ulcers, phelon, carbuncle, erysipelas of a malignant type. In phelon, especially the infection is on the fingers or the nail bed, where the cases are sloughing with terrible and burning pain. You will have patients who have typical presentations in conditions which have, these phelons and panaricium of the infection in the nail bed. If there is just infection and swelling, we can think of eparsal. But if the infection is prolonged and the swelling is profuse, we can think of a remedy which is stronger than eparsal, which is myristica. Next, you have something that is pain running from the finger towards the entire nervous tract. Dioscoria is another remedy. And over here today we are reading Anthracinum. This is a remedy which, after giving all these remedies, or else after giving one or two remedies, you have got stuck up and you cannot progress to thinking what to do next. Patient is stuck up. This is a nosode. It is going to clear up the case. If not cure, it will help you in few case symptoms. Set the track for lay the ground for another remedy, or maybe it can cure itself entirely. Next you have is comparison of this Anthracinum with another three remedies which are very similar in phelons: arsenic, carbolic acid and lachesis. Malignant pustules, black or blue blisters, often fatal in 24 or 48 hours. Lachesis and pyrogen are the top remedies which we think of in such cases. Anthracinum is another remedy which we should think of. Carbuncle with horrible burning pains, discharge of ichorous offensive pus, suspicious insect stings if the swelling changes color, and red streaks from the wound map out the course of lymphatics. Lachesis and pyrogen are to be thought of, and Anthracinum also. So you will have some boil or some swelling in one part, and the course of the lymphatics, or there is a red streak which goes from that boil towards the entire hand or leg. In such cases we can think of Anthracinum. You can think of lachesis if the sensitivity is too much towards pain, towards touch, and pyrogen if there is deep fever and restless nature of the patient. Herring says to call carbuncle a surgical disease is the greatest absurdity. An incision is always injurious and often fatal. A case has never been lost under the right kind of treatment, and it should always be treated by internal medicine only. So all those cases where the allopaths have advised incision of the boils, the abscesses, is going to be dangerous. If we can counsel such patients, we can think of remedies starting from belladonna, eparsal. We can think of remedies such as silicea. We can think of remedies such as moxol, Anthracinum, pyrogen, arsenic. Then we are going to help the patient to save from the hands of the surgical incision. Anthracinum is a remedy which it has been given in epidemic diseases, epidemic spleen diseases of cattle, horses and sheep. And as I have been saying from the beginning, and in all the Allen's keynote study streaks, that if you want to study a remedy which is new to you, or you don't know how to study this remedy, look at the relationships. In the relationships for Anthracinum, you have arsenic, carbolic acid, lachesis and sickle corn, and of course pyrogen. So all those cases where we think that there are one symptom each of these remedies and we don't know how to proceed, in such cases we can think of nosode. It is going to help clear the case, set the course for the next indicated remedy, or maybe cure itself. You can think of this remedy when arsenic is the remedy you think of, you have failed, or pyrogen is the remedy you have failed and they have not helped, and that's where Anthracinum gets its deserved place. So that's the small session of Anthracinum today, and next few days we'll take up the few nosodes which are related to Anthracinum which we have not covered so far. It is one of the important aspects of our prescriptions which we should take up any time in our practice. So that's what we conclude today's session. And if you have used Anthracinum or you have employed it in certain cases, please drop in the comments about this interesting case which you have used. I will be more than happy to share my own views as well.